Good morning. Today we have Dr. Christopher Gerber with us. He's a very famous neurosurgeon who's now working in the city of Calcutta. I would ask you a certain set of questions about your experience based on your visit to Search Chiroli. So, Dr. Gerber, could you briefly introduce about yourself and your work as a neurosurgeon?
Good morning. First of all, I'd like to thank you for inviting me here. It's been a fantastic experience. So I'd just like to share with you some of my background now. I'm a UK trained neurosurgeon. I've been working in Newcastle upon Tyne since 1996 as a consultant neurosurgeon, specialising mainly in spinal surgery. Maybe 95% of my work is spinal surgery. The rest of it's cranial, skull-based surgery. And what happened was around about 10, 15 years ago, I was looking for new challenges in life. And one of my colleagues in Newcastle, Dr. Robinson Gupta, said he was building a hospital in Calcutta. We would like to come on and see it and see what it was like. And so he said, sure. So I went there, spent some time there, really enjoyed it, and decided, well, perhaps this is, my next challenge, and moved there in about 2013.
On your visit here, what differences you see between the level of spine care back in the UK and this place?
Yeah, I think probably people are all aware that in the UK there's the National Health Service, which serves the majority of the population. The problem with that is the fact it's very expensive, possibly underfunded, and the standard of care varies from place to place. And quite often people go into the private sector. But for emergency work, there is a fail-safe. There's nothing better than the National Health Service. And that's probably the biggest difference here, because I think, although it's happening in some states now, there's very little government support for the common person. What I would call people, lower socioeconomic background, living in the cities or living rurally. These people don't have very good access to good care. Both countries, but here I think more so, because I think that your options are more limited.
What has surprised you about working in this kind of setup?
I shouldn't be surprised, but I was. But it's just the standard of care is outstanding, because the patient care, the surgery, the surgical possibilities are as good as you get in any tier 1 city, even the hospital I work in Calcutta. Type of operations do the same, the instruments are the same, the quality of the doctors is the same, the quality of post-op care.
What about your experience about the post-surgery program? Like there's a rehab program, you must have witnessed a Gerber therapy center.
Yeah, I was getting. The thing that surprised me very much is one of the rehab specialists in Calcutta was going about, we should use hydrotherapy, but it's not really readily available in Calcutta. And lo and behold, in the Search Hospital, one of the first things they have is a hydrotherapy pool. I thought, that must put them up in one of the sort of maybe top 5% of hospitals in the country with access to this. So it's great. I think they use it predominantly, I think, for stroke patients, but in spinal rehab, it has a role in people with chronic low back pain, mobility after surgery. So I think it's a great facility.
So I think during this course of the 1.5 days, you must have interacted with quite a lot of patients. So what memories do you take back home from here after interacting with them?
Yeah, it's very much a personal thing. One of the things about the UK is we sort of lost touch with the common man, the personal touch. And here, I think patients are very grateful because they don't have much money or any money, and to have treatment that is second to almost nothing in this country. And that really touched me. I think that's really inspired me to come here.
So, Dr. Chris, would you encourage other international doctors, to be part of such camps? And if yes, why?
I think to a certain extent that's been answered by my last few statements. I think this is a model that can be applied to many other countries in the world, not just developing countries, but developed countries as well, where there's a big discrepancy between what the well-off can afford and the least well-off can afford. So yes, I think this model can be used in many countries. I would encourage more doctors to come and visit the facility here, the Surgery Hospital. Dr. Butter's work in other camps. And I'm actually looking forward to maybe seeing what happens in other camps to compare and contrast, what actually happens in what I would say probably your preeminent camp, and to see how you're developing the service in other
Replicating it.
Yeah, exactly.
Yeah. We would love to have you there. We've got quite a lot of centers, more than 35 plus. And each weekend there are actually 3 to 4 centers running and providing service to the unreached and needy. Thank you for
Good.
coming.
Thank
We're glad to have you
Okay.
with us here. Thank you so much.